Anxiety was once described to me as an odor in the air. You know it's there, you can smell it, you just don't know where it's coming from. Today I will talk about what anxiety is, how it is treated, and how I will change it for my community. Shedding light on mental health. Anxiety quietly touches the lives of millions of people on a day-to-day basis. People around you that you may not even suspect have anxiety, but they are dealing with it and hiding it because they've learned how to do so due to the stigmatism that is attached to mental health. More people are having open dialogues about how mental health is changing their lives and how they are dealing with it. Anxiety, as defined by the American Psychological Association, is an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. There are several different types of anxiety. Generalized anxiety disorder, GAD, which is a generalized anxiety around your day-to-day tasks. Panic disorder has a sudden onset of panic or fear that is brought on by unknown reasons. Post-traumatic stress disorder, PTSD, results from significant traumatic events in one's life. Soldiers that have survived the horrors of war, people surviving horrific situations in their past. Social anxiety is the fear of people negatively judging you during a performance, whether it be social, at work, at school, or just out in the day-to-day life. Treatments include psychotherapy or talk therapy, talking with a therapist to build up trust and ways to deal with your anxiety. Anti-anxiety medications are also used. These medications help to calm and manage the symptoms of anxiety. Some people can build up an intolerance to them, so they have to keep increasing the dose to get higher and higher levels to maintain that level of relief. So doctors may only use it for short-term treatment plans. Antidepressants work to help you deal with the chemicals in your brain that set your mood. These take time to deal with, so you might have to be on them for a week before you will notice any kind of change or relief from your symptoms. Due to the side effects of these medications, doctors closely monitor their patients because it can cause increased suicidal thoughts in some patients. Working with your doctor and having an open dialogue with them is the best way to help deal with your anxiety and come up with a treatment plan that works for you. Do you know that May is Mental Health Awareness Month? And that May 6th was Mental Health Day for Children? It's things like this that help bring more awareness to mental health across the world on many platforms. Today, many people use their social platforms to express their journeys and battles with mental health. Kristen Bell uses her platform to show people how she deals with anxiety on a day-to-day basis and how she gets through it. Many other celebrities have come forward to talk about mental health and raise more awareness on it. We are all aware of Robin Williams dealing with depression at the time of his death, so we know that it affects anybody. For me and my children, I am glad we are having this dialogue and conversations are being started so that they know they are not alone and that talking about it does matter. So in conclusion, anxiety has many different symptoms and many different treatments. I will continue being an advocate for anxiety because the more I can bring awareness to it, the more my boys will benefit. If I can educate myself, I feel that I will be a better mom to my boys and be able to make them better educated about their anxiety and make better choices on dealing with it. I will end with a quote from Robin Williams. I think the saddest people always try their hardest to make people happy because they know what it's like to feel so sad and they don't want anyone else to feel that way.